start?
Start.
Okay. Good afternoon. Today we will discuss inhalation. Inhalation. What do you mean by the inhalation? In this method, the drug may be administered in the form of gas, vapors, or aerosols. The drug administered the medicinal gases such as drug administered medicinal gases such as oxygen and volatile oil or gaseous anesthesia. Have to be administered. Give me one. How to be administered by this route for local or systemic now again see the repeat because of some disturbances. Inhalation process. In this process, drug may be administered in the form of gas, next in the form of vapor and aerosol. The drug administered by medicinal gases such as oxygen, volatile oil. You know the properties of volatile oil is evaporate at a room temperature, and the gaseous anesthesia you can administer by this method, local or systemic effect. Inhalation means you can inhale the medicinal gases through the nose cavity, goes into the lungs. That called the inhalation process. Now you can see that. Now next should be you can administer also the aerosol. You know the aerosol? Aerosol preparation administered the solid drug in the form of aerosol by this route along with the gas, vapor and the solid doses solid drug in the form of aerosol preparation. Aerosol is a part of suffix H1. You had already studied. Next, now you discuss the next point is the advantages of inhalation. First, rapid onset of action. Rapid onset of action. You can use for asthmatic patient saline. You can spray in the mouth. Smooth muscle of bronchial smooth muscle, it should be the dilated by saline having the salbutamol, and they produce the rapid onset of action. They dilate the smooth muscle. Second, sterility is important. Second, Dose can be administered required sterility. Sterility is important because they free from the microorganisms. Dose can be removed without contamination. Dose can be removed without contaminations. Next, third, when administration is discontinued, the Holland drug diffuse back. The drug diffuse back and is rapidly elimination in the air. Because the property of the volatile, they are exposed in the atmosphere, they are eliminated immediately. Next, number 4, small dose is possible. Minimal side effects. Now see the disadvantages of inhalation process. Now the irritant vapor cause inflammation. Of respiratory tract. Second, it is expensive. Now, inhalation process, advantage and disadvantage over. Now next you can see the local application. Local applications, the last part of the externally applied. Local application is the simplest mode of administration of the drug at the site of action and where it produces desired effect. In this method, it is used topically. Applied by externally, skin, mucous membrane, or deeper tissues. It produces the effect because of the drug having optimum concentration. Optimum concentration means they are having the maximum concentration on the drug having the large scale, and their concentration is very, and they apply to the topically minimum quantity. They can apply topically minimum quantity of the drug. They produce the desired effect. Where the site of action, where the site of drug applied locally. Earlier you can see the skin, mucous membrane, and the drug tissue, skin, ear, eye, nose, throat, rectum, vagina and urethra. Now they can apply. The common dosage form of the drug are used in the dusting powder. Ointment, creams, emulsion, gels, lotion and drops, etc. Now these are the common forms of the drug are used. Externally you can apply, sometime in the body cavity, sometime in the external site of actions. Special type of the jelly and the vaginal tablets are available for the local applications. Special type of jellies and available for local application. It's a commonly used for the body cavities. Lozenges and the paints are used for the throat pains. Lozenges and paints used for throat pain. Earlier you can study in the classification the systemic absorption of drug from local application route is negligible. Systemic absorption of drug by in this route is negligible. Is negligible. And previously you can discuss patches, transdermal patches. Commonly nowadays the doctor is used the transdermal patches. You know it very well. Already I have to discuss this point. Stop now.